Welcome to our channel. We are going to discuss parietal bone. The parietal bone is a paired, flat bone that forms a significant portion of the human skull. It contributes to the cranial vault, which protects the brain. The two parietal bones are situated on either side of the skull, and together they form the top and sides of the cranium. Anatomy. Parietal bone is quadrilateral and flat. Situated between the frontal bone, anteriorly, and occipital bone, posteriorly. Bordered inferiorly by the temporal bones and greater wing of the sphenoid bone. The two parietal bones meet medially at the sagittal suture. External surface. Convex and smooth. The external surface of the parietal bone features the following anatomical landmarks. Parietal tuber. Superior temporal line. Inferior temporal line. Parietal foramen. The parietal tuber, or parietal tuberosity, parietal eminence, is a smooth prominence located near the middle of the external surface of the parietal bone. The superior temporal line is a curved line seen on the external surface of the parietal bone. It serves for attachment of the temporal fascia. The superior temporal line also represents the upper margin of the temporal plane. The inferior temporal line is another curved line on the parietal bone below the superior temporal line. It serves for attachment of the temporalis muscle. This line marks the upper limit of the origin site of the mentioned muscle. The parietal foramen is an opening occasionally present at the back part of the parietal bone. It serves as a passage for the parietal emissary vein, which drains into the superior sagittal sinus. Internal surface. The groove for the superior sagittal sinus is a shallow depression that can be seen on the parietal, frontal, and occipital bones. It forms a channel for the superior sagittal sinus. The margins of this groove come together as it passes downward and become continuous with the frontal crest. Sulcus for the sigmoid sinus, posterior region. In the posterior and inferior angle, there may be a faint groove associated with the sigmoid sinus, which drains venous blood from the brain. The impressions of cerebral gyri, also called the digital impressions, are flat indentations on the inner surface of the skull that correspond to the cerebral gyri, folds of the cerebral cortex, which produce them. Grooves for middle meningeal vessels. The internal surface is marked by distinct grooves that radiate superiorly and posteriorly. These grooves accommodate branches of the middle meningeal artery, which supplies the dura mater. The grooves start near the squamosal border and extend toward the sagittal region. Granular foveolae. These are small pits or depressions scattered along the internal surface, especially near the sagittal suture. They house arachnoid granulations, which are involved in the absorption of cerebrospinal fluid, CSF, into the venous system. Parietal foramen. Near the sagittal border, some parietal bones may have small openings called parietal foramina. These foramina allow emissary veins to pass through, connecting the venous sinuses inside the cranium with external veins of the scalp. Borders. Sagittal border, articulates with the other parietal bone at the sagittal suture. Squamosal border, articulates with the temporal bone. Frontal border, articulates with the frontal bone at the coronal suture. Occipital border, articulates with the occipital bone at the lambdoid suture. Angles. Frontal angle, at the bregma, intersection of coronal and sagittal sutures. Occipital angle, at the lambda, intersection of sagittal and lambdoid sutures. Sphenoidal angle, articulates with the sphenoid bone. Mastoid angle, articulates with the mastoid part of the temporal bone. Function. 1. Protection, encloses and protects the parietal lobe of the brain. 2. Support, contributes to the cranial vault, maintaining the shape and structural integrity of the skull. Ossification. The parietal bones develop through intramembranous ossification. Ossification centers appear during the 8th week of fetal development. Clinical relevance. Fractures. Parietal bone fractures can occur due to trauma, often affecting the middle meningeal artery and causing epidural hematoma. Sutures. Premature fusion of the sagittal suture, sagittal synostosis, can lead to scaphocephaly, a skull deformity. Fontanelles. In neonates, the parietal bones meet at the anterior fontanelle, soft spot, which ossifies by 18 to 24 months. Battle's sign. Bruising over the mastoid process, behind the ear, can suggest a basilar skull fracture involving the parietal bone. Now we're going to study temporal bone in humans. The temporal bone is a paired, complex bone located on the lateral sides of the skull, contributing to the cranial structure and housing structures of the ear. It plays a critical role in protecting the brain, supporting facial muscles, and facilitating hearing and balance. Here is the superior view. Anatomy of the temporal bone. The temporal bone consists of 5 distinct parts. 1. Squamous part. 2. Tympanic part. 3. Mastoid part. 4. Petrous part. 5. Styloid process. Squamous part of the temporal bone. It is thin, flat, and broad portion of the temporal bone that forms part of the lateral wall of the skull. The squamous part has 2 surfaces, temporal, outer, and cerebral, inner, surface. The temporal surface of the squamous part contributes to forming the temporal fossa. Also, this part features 3 anatomical structures. Zygomatic process. Mandibular fossa. Articular tubercle. Zygomatic process. Projects anteriorly from the squamous part and articulates with the temporal process of the zygomatic bone to form the zygomatic arch. Serves as an attachment site for the masseter muscle, which aids in mastication. Mandibular fossa, glenoid fossa. Located inferiorly, near the junction with the tympanic part. Forms part of the temporomandibular joint by articulating with the condyle of the mandible. In front of the mandibular fossa is the articular tubercle, a cylindrical elevation on the temporal fossa of the squamous part of the temporal bone. Temporal fossa. A shallow depression located above the zygomatic arch, contributing to the attachment area for the temporalis muscle. The cerebral surface of the squamous part features typical landmarks of the inner surface of the skull, which are impressions of cerebral gyri. Arterial grooves. The impressions of cerebral gyri, also called the digital impressions, are flat indentations corresponding to the cerebral gyri which produce them. And the arterial grooves are produced by pressure from arteries, primarily the middle meningeal artery and its branches. Superior border, articulates with the parietal bone, forming the squamous suture. Anterior border, articulates with the greater wing of the sphenoid bone. Petrosquamous suture. A vestigial suture found in some individuals, marking the boundary between the squamous and petrous parts of the temporal bone. Developmental aspect. The squamous part of the temporal bone develops from intramembranous ossification. It is separate from other parts of the temporal bone during early fetal development and fuses later. Clinical relevance. Fractures. The squamous part is thin and vulnerable to fractures, especially in lateral head trauma. Associated with temporal bone fractures, which can damage underlying structures like the middle meningeal artery or facial nerve. Epidural hematoma. Trauma to the squamous part may rupture the middle meningeal artery, leading to an epidural hematoma, a life-threatening condition. Temporomandibular joint disorders, TMD. The mandibular fossa's integrity is crucial for normal TMJ function. Conditions like arthritis, dislocation, or trauma can cause pain and restricted jaw movement. Infections. Otitis externa or media can extend to the squamous part, causing osteomyelitis or mastoiditis in severe cases. Neurosurgical landmark. The squamous part is often used as a landmark in neurosurgical procedures, particularly for accessing the middle cranial fossa. Tumors. Primary or metastatic tumors can affect the squamous part. For instance, squamous cell carcinoma may originate from the temporal bone. Tympanic part of the temporal bone is a relatively small part situated inferior to the squamous part, anterior to the mastoid part, and superior to the styloid process. The tympanic part features the petrotympanic fissure. External acoustic meatus, external auditory canal. The tympanic part forms the anterior wall, floor, and part of the posterior wall of the bony external acoustic meatus. The canal leads to the tympanic membrane, eardrum, and plays a role in sound conduction. Tympanic sulcus is a groove on the inner surface of the tympanic part that accommodates the tympanic membrane. Provides an anchoring point for the membrane. The tympanic part is closely associated with the styloid process, a slender, pointed bony projection of the temporal bone. This proximity is relevant in surgical approaches and certain syndromes, for example Eagle syndrome. The petrotympanic fissure is a gap which stretches from the temporomandibular joint to the tympanic cavity. It serves as passage for the facial nerve, cranial nerve 7, to the infratemporal fossa, and the chorda tympani which passes through and joins the lingual nerve. Developmental aspect. The tympanic part originates from the tympanic ring during fetal development. This ring enlarges and fuses with the surrounding temporal bone to form the adult tympanic part. Clinical relevance. Otitis externa, swimmer's ear. Inflammation of the external auditory canal, often affecting the tympanic part of the temporal bone. Commonly caused by bacterial or fungal infections. Fractures. Temporal bone fractures, especially involving the tympanic part, can result from blunt trauma. May lead to external auditory canal lacerations. Tympanic membrane perforations. Hearing loss, conductive or sensory neural. Cholesteatoma. An abnormal growth of squamous epithelium in the middle ear that can erode the tympanic part of the temporal bone. Requires surgical management to prevent complications. Tympanic membrane perforation. Injury or infection can perforate the membrane and involve the tympanic sulcus. May affect hearing and require surgical repair, tympanoplasty. Eagle syndrome. Caused by elongation of the styloid process or calcification of the stylohyoid ligament, closely associated with the tympanic part. Symptoms include pain in the throat, face, and ears. Temporal bone tumors. Tumors such as squamous cell carcinoma can originate or invade the tympanic part, affecting hearing and ear function. Requires imaging and often surgical intervention. Mastoid part of the temporal bone. Located posterior to the external acoustic meatus. And inferior to the squamous part and contiguous with the petrous part. This part features mastoid process, containing mastoid cells, mastoid antrum, mastoid notch, and other features are groove for occipital artery, mastoid foramen, groove for sigmoid sinus. The mastoid process is an extension of the temporal bone located behind the ear, just posterior to the external acoustic opening. It is somewhat conical in shape. It serves as a major attachment site for muscles, including sternocleidomastoid muscle, splenius capitis muscle, longissimus capitis muscle, posterior belly of the digastric muscle. Here is coronal section of temporal bone, showing the mastoid air cells in more detail. The mastoid cells are a number of air-filled spaces within the mastoid process, variable in size and number. They become pneumatized during the first year of life. The mastoid antrum is a closed space within the mastoid process. Its posterior-superior part is continuous with the tympanic cavity, and its inferior part communicates with the mastoid cells. Mastoid air cells' functions are lightening the skull, resonating sound, regulation of air pressure in the middle ear. Mastoid notch is a groove located on the medial side of the mastoid process. It serves as the attachment site for the posterior belly of the digastric muscle. Medial to this notch is the groove for the occipital artery or occipital groove which houses the occipital artery. Behind the mastoid process on the mastoid part of the temporal bone is the mastoid foramen. It serves for additional venous drainage from the cranial cavity, as it transmits an emissary vein that connects the sigmoid sinus with the suboccipital venous sinus. The groove for the sigmoid sinus is located in the posterior cranial fossa, found on 3 bones, beginning on the lateral part of the occipital bone, then curving around the jugular process on the mastoid part of the temporal bone, finally, turning sharply on the inner surface of the parietal bone. Here, it continues as the transverse groove. Occipitomastoid suture. The mastoid part articulates with the occipital bone at this suture. Developmental aspects. The mastoid part is underdeveloped at birth and consists of a smooth surface. The mastoid process begins to develop after birth due to the attachment of the sternocleidomastoid muscle. Full development occurs during early childhood. Clinical relevance. Mastoiditis. Infection of the mastoid air cells, often a complication of untreated otitis media, middle ear infection. Symptoms include pain, swelling, and redness behind the ear. Can lead to serious complications if the infection spreads to the brain or venous sinuses, for example sigmoid sinus thrombosis. Managed with antibiotics or mastoidectomy in severe cases. Temporal bone fractures. Fractures involving the mastoid part may affect the air cells, sigmoid sinus, or adjacent structures. Symptoms include hearing loss, facial nerve paralysis, and cerebrospinal fluid leakage. Sigmoid sinus thrombosis. The close relationship between the mastoid part and the sigmoid sinus makes it vulnerable to thrombosis in cases of mastoiditis or otitis media. Symptoms include headache, fever, and signs of increased intracranial pressure. Surgical importance. The mastoid part is a critical landmark in otologic and neurosurgical procedures. Mastoidectomy, a surgical procedure to remove infected mastoid air cells or gain access to the middle ear. It is also an approach for cochlear implant surgeries. Congenital anomalies. Hypoplasia or aplasia of the mastoid process can occur due to genetic or developmental abnormalities. May result in compromised muscle attachment or structural integrity. Tumors. Benign or malignant tumors can involve the mastoid part. Primary mastoid tumors are rare, metastatic lesions or extensions from adjacent areas are more common. Facial nerve involvement. The facial nerve passes near the mastoid part and can be affected in cases of mastoid infections or surgeries. Damage may result in facial paralysis or weakness. Hearing disorders. Diseases of the mastoid part, especially involving the air cells, can contribute to conductive hearing loss. Petrous part of temporal bone. Situated at the base of the skull. Wedged between the sphenoid and occipital bones. Forms part of the middle and posterior cranial fossae. It is pyramidal in shape, with its base oriented laterally and apex pointing medially and anteriorly toward the foramen lacerum. It has an apex and 3 surfaces, anterior, posterior, inferior, and 3 margins, anterior, superior, posterior. The apex of the petrous part of the temporal bone features the anterior or internal opening of the carotid canal, and forms the posterolateral margin of the foramen lacerum. The carotid canal is a bony passage for the internal carotid artery. The canal is located in the apex of the petrous part of the temporal bone. Through it the mentioned artery reaches the middle cranial fossa from the neck region. The foramen lacerum is a triangular-shaped hole in the base of the skull, located between the sphenoid bone, the apex of the petrous part of the temporal bone, and the basilar part of the occipital bone. The foramen lacerum fills with cartilage after birth. The anterior surface of the petrous part of the temporal bone features tegmen tympani, arcuate eminence, hiatus for greater petrosal nerve, hiatus for lesser petrosal nerve, trigeminal impression. The tegmen tympani is the roof of the tympanic cavity. It is a thin bony plate found on the pyramid of the temporal bone anterolateral to the arcuate eminence. The arcuate eminence is an elevation on the anterior surface of the pyramid. This eminence is produced by the underlying anterior semicircular canal. The hiatus for the greater petrosal nerve is a shallow groove in the petrous part leading to an oblique opening. It connects the facial canal to the middle cranial fossa. The opening serves for the passage of the greater petrosal nerve and the petrosal branch of the middle meningeal artery. The hiatus for the lesser petrosal nerve is an opening that serves as a passage for the lesser petrosal nerve as it separates from the glossopharyngeal nerve, cranial nerve 9. This opening connects the posterior cranial fossa to the external surface of the skull. The trigeminal impression is a shallow, oval depression on the anterior surface of the petrous part of the temporal bone. It is produced by pressure from the trigeminal ganglion located here. The posterior surface of the petrous part of the temporal bone has two openings. Internal acoustic opening, leads into the internal acoustic meatus. External opening of vestibular aqueduct. The internal acoustic opening is a small opening at the beginning of the internal acoustic meatus, or internal auditory canal. The opening can be seen is in the posterior cranial fossa of the skull. The internal acoustic meatus runs laterally into the petrous part of the temporal bone. Its content includes components of the facial nerve and vestibulocochlear nerve, cranial nerve 8, the vestibular ganglion and the labyrinthine artery. There are 5 nerves that run through the internal auditory canal: the intermediate nerve, sensory component of cranial nerve 7, facial motor root, motor component of cranial nerve 7, cochlear nerve, component of cranial nerve 8, inferior vestibular nerve, component of CN8, and the superior vestibular nerve, component of CN8. A horizontal ridge called the falciform crescent divides the internal auditory canal into superior and inferior portions. The facial nerve and the superior vestibular nerve go in the superior portion of the canal. The cochlear nerve and inferior vestibular nerve run inferior to the falciform crescent with the cochlear nerve situated more anteriorly. The vestibular aqueduct is a narrow canal extending from the endolymphatic space of the internal ear to the posterior wall of the petrous part. Its external opening can be seen on the posterior surface of the petrous part of the temporal bone. The inferior surface of the petrous part of the temporal bone features the following structures. Styloid process. Stylomastoid foramen, external opening of the facial canal. Jugular fossa. Petrosal fossula, featuring the tympanic canaliculus. Carotid canal. Musculotubal canal, divided into 2 semicanals. Semicanal for tensor tympani muscle. Semicanal for auditory tube. The styloid process is a long process extending from the inferior surface of the petrous part of the temporal bone. It is located in front of the jugular fossa. The stylomastoid foramen is a round opening located on the external surface of the skull between the styloid and the mastoid processes. It is the external opening of the facial canal and transmits the facial nerve, CN7, and the stylomastoid artery. Stylohyoid, stylomandibular ligaments are attached to it. And styloglossus, stylohyoid, stylopharyngeus muscles are its seed to styloid process. The facial canal is a bony canal running through the temporal bone containing the facial nerve, CN7. It is the longest canal, around 3 cm, for a nerve in the human body. The inner opening of the canal is located in the internal acoustic meatus. And its outer opening is the stylomastoid foramen presenting on the external cranial base, as mentioned before. There is also a small canal arising from the facial canal called the canaliculus for chorda tympani. The canaliculus for chorda tympani is a small canal in the temporal bone, which starts at the descending part of the facial canal and ends at the tympanic cavity. It serves as a passage for the chorda tympani, a branch of the facial nerve, into the tympanic cavity. The jugular fossa is a deep depression on the external base of the skull, specifically, on the inferior surface of the temporal bone posterior to the carotid canal. The jugular fossa houses the superior bulb of the internal jugular vein. The petrosal fossula is a slight depression in the bony ridge between the carotid canal and the jugular fossa. It is occupied by the otic ganglion. The petrosal fossula presents the opening of the tympanic canaliculus. This small canal serves as a passage of the tympanic nerve and the inferior tympanic artery. The musculotubal canal is a double canal within the petrous part of the temporal bone for the auditory tube and the tensor tympani muscle located in front of the carotid canal and leading into the tympanic cavity. The canal is divided into two semicanals, for the tensor tympani muscle and for the auditory tube. The semicanal for the tensor tympani muscle is the superior division of the musculotubal canal for the tensor tympani muscle. The semicanal for the auditory tube is the inferior division of the musculotubal canal that forms the bony part of the auditory, pharyngotympanic, tube. The anterior margin, or anterior angle, of the petrous part of the temporal bone can be divided into two parts, lateral and medial. The lateral part joins the squamous part of the temporal bone with a petrosquamous fissure. The medial part of the anterior margin is free and articulates with the sphenoid bone. The superior margin, or superior angle, of the petrous part presents the groove for the superior petrosal sinus, and is the attachment site for the tentorium cerebelli. The groove for superior petrosal sinus is grooved into the superior border of the petrous part of the temporal bone accommodating the superior petrosal sinus. The posterior margin, or posterior angle, of the petrous part presents the following features. Groove for inferior petrosal sinus. Jugular notch, with external opening of cochlear canaliculus. The groove for inferior petrosal sinus is formed by the junction of the petrous part of the temporal bone with the basilar part of the occipital bone. It houses the inferior petrosal sinus, one of the dural venous sinuses. The jugular notch is an indentation on the posterior margin of the petrous part forming the anterior margin of the jugular foramen. It also features the external opening of the cochlear canaliculus, which is a small bony canal for the cochlear aqueduct. The petrous part of the temporal bone also houses the tympanic cavity and the internal ear structures. The tympanic cavity is a narrow, irregular space situated between the external and internal ear. Therefore, it is a structure of the middle ear. The internal ear is an essential part of the auditory and vestibular system, where sound waves are converted into electrical impulses. It consists of the bony labyrinth and the membranous labyrinth, which lies within the bony labyrinth and forms small sacs and tubules. Key openings and foramina in the temporal bone. External acoustic meatus. Internal acoustic meatus. Carotid canal. Stylomastoid foramen. Jugular foramen. Petrotympanic fissure. Foramen lacerum. Mastoid foramen. Tympanic canaliculus. Auricular foramen. Sigmoid sinus groove. That's the end. Thanks for watching.